So now we are going to discuss the management of each different type of headache. So as I told you previously that management starts with explaining your diagnosis to the patient in simple words, okay? And addressing any ideas or concerns that the patient might have expressed when you ask them during the ICE part of our consultation, okay? So you must explain the diagnosis with a lot of empathy, okay, because it is a difficult thing for the patient, and you must also explain it in a very simple language in a few sentences, and always ask the patient if he's clear with what you just explained. Okay, so let's start with subarachnoid hemorrhage first. So in subarachnoid hemorrhage, how to explain your diagnosis? So we'll tell the patient that unfortunately, um, I suspect that your headache is because of a bleeding inside your brain, because of a ruptured blood vessel. This is called as subarachnoid hemorrhage. Okay, so always explain the diagnosis first and then name the diagnosis. So here you have told him that there is bleeding inside your brain due to a ruptured blood vessel, which is called as subarachnoid hemorrhage. Do not start with you have subarachnoid hemorrhage, which is the bleeding in your brain, because it's a big name and patient's going to be confused with it. The patient doesn't care about what the disease is called. He cares about understanding it and knowing about the management. Okay, so explain it to the patient. Ask him, "Am I clear so far? And would you like to discuss how we are going to manage this today?" Okay, so as you would already know that subarachnoid hemorrhage is a serious condition, so we are going to admit this patient. So we'll tell the patient we are going to admit you today, and we are going to do some investigations that will include your routine blood tests and a scan of your head, which is basically CT scan. To tell the patient a scan of your head, okay, to find out the exact location of bleeding. Okay, and then as you know, there's symptomatic treatment. So we tell the patient, I will give you some pain relief medications. So in PLEP 2, in every scenario, always involve senior. What I usually do is I mention senior involvement after symptomatic treatment at the stage where I'm going to discuss specific treatment, because symptomatic treatment like FY2, FY1, they can give symptomatic treatment, they can give pain relief medication, they can give antiemetic medication, but for specific treatment like antibiotics or specialized drugs, like in this case, nimodipine, we need seniors' consent. Seniors are going to prescribe it. So I always involve senior at the specific medication stage because it makes sense to me. Okay. So I will tell the patient I'm going to inform my seniors about your case as well. And then they're going to prescribe you a medication to protect your brain or to improve circulation in your brain, which is called as nimodipine. We will also arrange an urgent review with the neurosurgery team, and they are going to have a look with you as well. Okay, and then I will safety net him. So as I'm already going to admit this patient, so I'll just tell him that there is a bell near your bed, and if you feel like your condition is worsening, just ring the bell and one of us will be around. Okay, so that was all about subarachnoid hemorrhage. Okay, with meningitis and encephalitis, you will explain to the patient that your headache is because of uh, inflammation of the covering of your brain. This is called as meningitis. Always include the word unfortunately, okay? So tell the patient that unfortunately it seems like your headache is due to inflammation of the covering of your brain. This is called as meningitis. It usually happens whenever there is an infection. So in meningitis and encephalitis, we admit the patient. So we will tell him that we are going to admit you today, if that's okay with you. We are going to do some blood tests. Which will include routine blood test and specific test to find out what bug is causing this infection. And we are also going to do a scan of your head and might take some fluid from your back. Okay. Symptomatic treatment, give pain relief medication, and we'll tell the patient we are going to give you antibiotic according to the hospital protocol. Tell them that I'm going to inform my seniors. They'll start you on a specific medication called steroids to reduce the inflammation in your brain. I will also inform public health authorities, because meningitis and encephalitis is basically, it is a notifiable disease. So we'll tell the patient that because this infection is contagious, I'm just going to inform public health authorities to trace anybody that might have come in contact with you and to treat them as well. Ask the patient to inform family members, because we need the family members to get tested and treated as well. And safety net the patient. So we are going to admit him. We are going to tell him the same thing as above. Okay. Joint cell arthritis. Joint cell arthritis, we are going to explain the diagnosis. We are going to tell the patient that unfortunately it seems like the defense system of your body is acting abnormally and damaging your blood vessels, especially those in your temple, which is causing the headache. It is a bit serious condition, so we are going to admit you today. So now in giant cell arthritis, the trick is whether the patient presents to the hospital or to the GP. So in GP, you cannot do anything, you cannot do any tests or anything. So we are going to immediately refer this patient to the hospital. But if this patient presents to the accident and emergency, we are going to admit this patient for investigations. So we are going to do investigations like routine blood test and inflammatory markers, that is ESR and CRP. And then, as you already know, that in giant cell arthritis, we just do the inflammatory markers and we start the patient on steroids even before the biopsy. Okay, so we'll tell him that we are going to do some blood tests, which include routine tests and inflammatory markers. We are going to inform our seniors. They are going to give you a specific medication called steroids, which will reduce the inflammation in your blood vessels. And they will arrange for a specific test called biopsy. So what happens in biopsy is they will take a portion, a small portion from blood vessels in your temple with the help of a needle and examine it under microscope to confirm the diagnosis. Okay, we are also going to give him pain relief medications, and obviously we are also going to give this patient, PPIs to protect the stomach, because we are going steroids. So you can mention that as well. And then we are going to safety net this patient that if you feel like your condition worsen, or you feel like your vision is worsening, your vision is disturbed, then please ring the bell near your bed, and one of us will be around. Okay. Steroids, basically, just so you know, in this case, steroids are oral and they are long term. So in case the patient asks, just tell him that they are going to be taken orally and there for a long time, usually up to 2 years. And depending upon the response, they are then slowly tapered off and then ultimately completely stopped. But tell the patient that never ever stop this medication on your own, because it can have serious side effect when you stop them abruptly. Okay. After this, we have hangover headache. So in hangover headache, we are going to explain the diagnosis that you are experiencing this headache because of consumption of large amount of alcohol. What alcohol does is it makes you pee more, and there is loss of water from the body, which causes dehydration and thus headache. So treatment for hangover headache is really simple. It's just paracetamol, and will advise the patient to drink lots of water and other fluids like soup, and but advise them not to not to drink any fizzy drinks like soda. Okay, we'll also tell the patient to eat sugary food, something rich in carbohydrates. Advice for the future will be to never drink on empty stomach. Always drink water in between the drinks, and not to drink more than 14 units of alcohol per week, and spread the drinking over more than 3 days. Never drink, all the 14 units in one day. Okay, yeah, so that is the advice about hangover headaches. You would also need to calculate alcohol units in this station if the hangover headaches shows up, because if the patient tells you, I was drinking alcohol last night, and you ask how much alcohol, and the patient tell you 3 glasses of wine or 4 glasses of wine. So how do you calculate how much units of alcohol that constitutes, and to label it as excessive consumption of alcohol? So for that, you need to, calculate alcohol units. So I have a small video on calculating alcohol unit as well. So you can watch it. It's available on my YouTube channel. Migraine. So now coming to the chronic type of headaches, migraine. So explain the migraine, telling the patient that migraine is a common type of headache, especially common in female. It doesn't have any known cause, but there are certain triggers. Um, so sorry, this line doesn't belong here. This is for the tension headache, okay? So for migraine, you explained that there is no known cause, but there are certain triggers. So what are you going to do for this patient? Tell the patient that please keep a headache diary in which you note the um, timing of headache and the triggers and what medication you took for it. So that next time when you come for an appointment, we can have a look at it. Okay. So when you note the triggers, try to avoid those triggers. And regarding medications, prescribe paracetamol when you feel the headache is coming. Okay. So tell the patient that you can take paracetamol when you feel the headache is coming, that is during an aura. Triptans you will prescribe, but you will tell the patient to only take triptans when the headache actually starts. This is according to the NICE guidelines. So NICE states that patient should take either paracetamol or NSAID when there is aura and the patient feel like the headache is about to start. But when the headache actually starts, then NSAIDs and paracetamols are no longer helpful. Only triptans are the one that can abort the headache, but they are not for regular use. Okay. So the patient is complaining of headache for like 3 to 4 times a month. That is having a very negative impact on the patient's activities of daily living. It's affecting their job. It's affecting their sleep. So then you will prescribe prophylactic medications, which can be either propranolol, topiramate, or amitriptyline. All these are equally effective. It will depend upon the patient. For example, in asthmatic, you cannot give propranolol. In pregnant patient, you cannot give topiramate. And if patient is elderly, then you will exercise caution with amitriptyline. So it will depend upon the patient, but this stuff they don't usually ask in PLAB 2 because PLAB 2 is at the level of FY2. Okay, tension headache. So in tension headache, this line here belongs here, okay? So in tension headache, you will explain it to the patient that your headache is because of stress. And the management is equally simple. You will tell them that please keep a headache diary, note your trigger, and try to avoid it. Paracetamol and relaxation technique. So you'll tell the patient try to relax, try to do some relaxation activities like try some hobbies, yoga, go for a walk, listen to relaxing music, stuff like that, whatever the patient's like, okay? Tell them not to excessively use medication because sometimes they can also cause the person to be dependent upon these medications. So try some relaxation activities, some relaxation techniques instead, and that will make them feel better. Okay, so carbon monoxide poisoning. Carbon monoxide poisoning is another type of, chronic headache. So in this case, we will explain it to the patient that carbon monoxide is basically a poisonous gas that can make you ill if you breathe in. Okay. It can cause headache, dizziness, weakness, confusion, and chest pain. So obviously, when you ask the patient in this station, when you are taking history, and when you ask the patient anything else apart from the headache, so they might have one of these symptoms or one or more of these symptoms. Okay. So we'll tell the patient can cause headache, dizziness, blah blah blah, and tell the patient that common household appliances like boilers and cookers can produce carbon monoxide if they are not properly installed or not maintained properly. Okay, so we will explain in this way to the patient, and the management here is basically checking the levels of carbon monoxide in the patient's blood and give oxygen by face mask if the level are high. Okay, but other than that, we'll also give advice to the patient. We'll tell the patient if there are any other people living with him or her, and call them as well and ask them to come to the hospital to get tested and check whether any boiler or cooker that is not properly maintained or recently installed by an engineer, get it checked by engineer or something, and open the windows to let the fresh air come in. You will also inform about this case to public health authorities as well, because this is also a notifiable disease. And The other thing that you will advise the patient is to get a carbon monoxide alarm installed. Okay. During history taking, when you are taking history and you suspect that this is a chronic headache, okay, the patient says that I feel this headache when I'm at home and I feel better when I am outside. And you rule out the other differential diagnoses by asking a few questions about them. And then, so the one question that you need to ask about, ask to confirm your diagnosis about carbon monoxide poisoning is whether you have any recent installed boiler or cookers, or whether your boilers are, and cookers properly maintained. So hopefully the patient will tell you that, no, my boilers and cookers are not properly maintained. I'm renting this house and the landlord is not taking proper care regarding the maintenance of these things. So it will kind of confirm your suspicion, and it also let the examiner know that you know about the causes of carbon monoxide poisoning. Okay, so that was all about the management of headache, and I hope it was helpful.